EMT students. We heard you're carrying plasma in your trucks. Can you tell us more about it?
So that's a really great question. So let's talk about what's new. Let's talk about blood products. Let's talk about that availability here at ESD 11. Life is about volume and flow. I've told you that. Volume of blood, you got to have it. You got to make it go round and round. Trauma is the #1 cause of death for people age 1 to 44. What we're trying to do about it, we're going to talk about it. So the availability and the administration of blood products in the field through EMS is something we've been working on for a long time. Previously, only high sophisticated air medical providers were able to carry blood from the hospitals. Now, through working with the blood bank, we're able to get those blood products on our supervisor's vehicle to get them to the critical scenes. The availability of this really precious resource has come down to having it with our supervisors to respond to those scenes. The cost of maintaining the blood products, the cost of administering them, et cetera, is significant. So what we want to do is make sure that it's really, really optimized to those folks that really, really need it. Blood loss is the #1 preventable cause for trauma death. So if we can get there at the scene, et cetera, and get this administered, again, we're going to save thousands of lives. This is Mark Price. Let's talk a little bit about our setup.
Absolutely, Doc. So we use the Delta cooler specifically. That's going to help maintain a specific temperature, which is required for the blood products between 2 degrees and 6 degrees Celsius. What we wind up doing from here, this is connected with GPS tracking. It's also connected with modem itself. So there's constant connection as to what the temperature is. And this will last roughly 48 to 72 hours as it is without battery connection. We keep it plugged in all the time. We have 2 units of plasma in here at this point. Anytime this were to go outside of its normal temperature, we would be notified immediately. So that way we keep this precious resource safe and available for the community at all times. Within here, we carry 2 units of liquid plasma, and specifically for these, our protocols are designed to be able to provide this quickly and efficiently. We're looking to try and meet people in the community with these products roughly 15 minutes from the incident, from whenever they're notified. Now, what's important with this is, in addition to these units, we're transporting to level 2 trauma center at a minimum. So that way we can make sure that additional products are available and that anyone in the community that's receiving these will get the continued care that they need. So within here, we actually have our tubing, and the way this tubing is worked through connects to the product itself. There's 1 chamber, but there are 2 areas. So we connect this with fluid, administer both, and we place the unit of plasma in a pressure infuser. So that way we get it into the patient quickly. We're able to give them the products that they need and help establish some good care early on. Due to the fact that our system runs roughly around 180 calls a day, this is such a precious resource. We need to make sure that it's available with the supervisors, which is why the supervisors right now are the only ones carrying it. That way we can get this resource for very specific patients in a very quick time. Say this battery dies and something occurs. I get an immediate notification on my phone, which allows me to go and address this issue immediately to keep this product available.
Liquid plasma is widely available to us, so it's really easy for us to obtain. The other thing is it's got a really good shelf life. We can maintain it for a longer period of time. It's got a lot of applications. 40 to 60% of patients who are bleeding are not trauma patients. They're medical patients, they're GI bleeders, they're obstetrical complications that are also going to need blood, not just the trauma patients. Additionally to that, the liquid plasma in current research looks like it's going to be the resuscitation fluid we need for sepsis, for brain injury, for a lot of things in the future. So we are really putting this in our armamentarium. We may advance to whole blood, etc., to keep this, but again, we're trying to do the best for the broadest community we can. It's not just another drug you throw on the truck. It has to be maintained at a special temperature. It's not frozen, so we can give it very quickly, but it's got to be really close to that freezing point. So we have to invest in equipment to be able to carry that blood and monitor that.
BloodCom is the application that we use with our Delta coolers. This application itself will monitor the temperature specifically between that 2 and 6 degrees Celsius that's important.
So this is not just a standalone project. We have coordinated with the local hospitals, the trauma centers, the trauma surgeons, etc., about evolving this product. The local hospitals, etc., have a direct to the OR program, which avoids any unnecessary delays in the ER. We're really trying to limit the amount of time that you're going to be in a sad state from any kind of hemorrhagic shock problem with trauma.
And we've spent some of the time with the hospitals making sure that the continuity of care, once these are given, it's continued on through almost all the centers that we transport to.
Yeah, the 2 liters of plasma that we carry are an essential initial intervention. They are going to follow that up with whole blood, whatever else they need, additional medications, the surgery, the rest of the resuscitation. So we are really trying to focus on getting what is needed as early as possible to the patient. For every 1 minute we can save in the administration of needed blood products, we're adding 10% to your survival. So again, that's what we're all about. For the Harris County ESD 11 Mobile Healthcare, I'm Dr. Jay Kovar.